If you've ever had a hamstring injury, you know that it can be a real pain in the ass. We often see patients with hamstring injuries and they say this occurred from trauma or exercise, but we know what they're really doing. First thing we do when we evaluate a hamstring injury is to make sure the diagnosis is correct. We want to make sure it's truly a hamstring injury and not something like a lumbosacral radiculitis or some other ligament injury like the sacrospinous or sacrotuberous ligament. So if we're confident it's a hamstring injury and time and rest haven't significantly improved the pain, then the next step is physical therapy to help strengthen the muscle, which then helps strengthen the tendon. In addition to physical therapy, I also like to suggest things like low-level light therapy and heat to help optimize recovery. If conservative treatment fails, then we often consider advanced imaging like MRI or ultrasound to evaluate the tendon. If there is a complete rupture or avulsion, often we could tell this on initial exam, but if we see this on advanced imaging, we'll often send them off to see orthopedic surgery for potential repair. If the tendon is intact with either minor tearing or tendinopathy changes, then we would consider something like platelet-rich plasma injection. I like to avoid corticosteroids for tendons as we know they can be harmful in the long term. Essentially with the platelet-rich plasma, we're trying to stimulate the healing of the tendon. The platelet-rich plasma has growth factors and cytokines that help stimulate the tendon cells in the recovery process. Even with PRP, we still need to continue strict physical therapy and home exercises to help ensure proper healing. So here's a couple studies just to put you to sleep. This study looked at PRP for acute hamstring injuries in athletes, and they saw that PRP injections resulted in a shorter time to return to play. Another study looking at chronic injuries, a retrospective review of 22 patients, showed 68% of patients had over 50% relief after platelet-rich plasma injections. So if you're dealing with a hamstring injury, it may be worth talking with your doctor about platelet-rich plasma injection. It's not a magic bullet, but maybe a decent option. Until next time.